Hey, it's Brenda. Please hit that like and subscribe button. Balance with Brenda, Monarch Physical Therapy, physical therapist for 29 years. Just wanted to take a moment, and I said I would review a little bit more detail. This is really for anyone, but I think if you're in perimenopause, menopause, older than 40, this may be very helpful for you. I tell people this all the time and they feel like it is brand new information. So again, just to review, I'm a Gen Xer with very limited media skills, and so you'll just have to deal. But I think it'll give you enough information to allow you to look on your own computer, have some conversations with your physicians, and get the information that you need. So if you happen to be having increased bladder urgency and frequency, having to go all the time, reacting to foods, different things, having to go constantly, one of the things that may be happening as your hormone levels decrease, they talk a lot about how many estrogen receptors there are in the pelvis. And there are a lot. And so as your estrogen level declines, that tissue basically is not as flexible and pliable and healthy as it was before. And so over time, it gets, dried out would be a good word, maybe. I'm a very visual thinker, so I think of things in different terms, but fresh sausage, dried sausage. Anyway, as that tissue is not as flexible and not as hydrated as it was before, it sets itself up for little micro tears and areas. So it becomes a lot easier to have urinary tract infections. And I don't want to be 90 and septic. I don't want to be that girl. So there are resources available to you. So Dr. Rachel Rubin is this great urologist who's become this great advocate for women. Vaginal estrogen is not, it stays in the pelvis. So it's not something that's going to be metabolized by the liver like an oral or maybe a patch. So it's going to work in that area. And her website has really helpful information on it. So in my low-tech way, I'm going to show you that. And then it's a printable that you can download, print out, take to your physician, and have a good conversation with your regular physician and say, hey, let's try this out. And that may give you some educational opportunities or some opportunities to find a physician that's open to this, because honestly, things keep changing, and a lot of this wasn't taught in the last probably 30 years. And so, like anything else, sometimes it's hard to keep up with all that education and what's coming out. But this is a low-tech, low-budget thing that I believe can help a lot of people. And obviously, if you have some cancer history or some different things, you want to talk to your physician about that, and there's some other options available as well. So let's switch gears here for a moment. Okay, so we're up here at rachelrubinmd.com. I'll put the link in the comments. She's got all kinds of information about what is Genitourinary Syndrome of Menopause. Lots of great links on here, different information. Symptoms of this include everything in this chart. So a pelvic floor PT is a great resource to also help with a lot of these issues, but it's amazing how having some vaginal estrogen as well as pelvic PT is very helpful in the process as well. So there's a lot of good research. You know, you can learn more about this. They have changed the black box warning from the FDA, so that's something good. You can print these clickable links out and bring them with you to your physicians. Now this one's really nice. You can download this pocket guide that basically you can print out and give to your physician, and it gives different options. There's creams, there's an insert, they make pearls that dissolve so you don't have to mess with the cream. There's even a estradiol ring. There's different options depending on where you're at in life and what you're comfortable with. So there's more education on their YouTube channel, and you can learn from physicians. So it's just a nice resource of things that you can, take to your physician and have a good conversation about what you need. So my hope is that this is something younger women can know about in advance and proactively speak to their providers about if they start noticing some changes in their body. It's also something that just becomes a lot more common. Like, I feel like a tube of the cream, you can search on different websites and things, but I mean, we're talking like $13. This is not like a high dollar money making. This is pretty basic, and there's a lot of money that can be saved from hospital stays, from just the distress of being septic, from having UTIs kind of go out of control quickly. I don't know if any of you have seen that in older people, where, I mean, they kind of lose it, and it's very scary. It's also very hard on their kidneys. It's hard on the rest of their system. So if we can just maybe prevent some of that, it does a lot for quality of life, but in the bigger scheme of things, it is saving our healthcare system a lot of money, and it's simple. So something to consider. Reaching out, seeking out pelvic health PT is huge, but also finding a healthcare practitioner that you can bring some information to and have a discussion about. And you've got some printouts. They can do their own research and get back to you, and just open the conversation. All right, have a great day, and I will try and put links in the comments and just be a resource. The more you know, the better you are. Have a great day.